If you're planning on working past 65, like many people are these days, enrolling in Medicare at the wrong time or not enrolling at all can cost you for the rest of your life. My name is Wendi. I'm an independent insurance broker, and I focus solely on helping Medicare recipients and people planning for retirement. And today, I want to walk you through exactly how Medicare works when you work past 65, because this is where I see a lot of my clients make a very expensive mistake. The biggest question I get is, if I'm still working, do I really need to sign up for Medicare? And the answer is, it depends. It depends on your employer coverage or your spouse's employer coverage. If your employer has at least 20 employees, typically you can delay Part B with no problem and no penalty at all. But if you have fewer than 20 employees where you work, Medicare would actually become primary to any employer coverage you may have, and you would want to enroll into Part B in order to avoid penalties later. And this is where people make a very costly assumption. They assume they should stay on their employer plan without even comparing their Medicare options. Before you decide whether or not you're going to opt out of Medicare and stay on your employer plan, I think it's incredibly important to meet with someone and do a side-by-side comparison. Because in some cases, Medicare may actually have lower costs depending on your employer coverage. It also may give you far better protection and less financial exposure. And in many other cases, staying on an employer plan and opting out of Medicare while you're working actually makes more sense. The point is that you really don't know until you do a side-by-side comparison with your employer coverage and some Medicare options. I can actually give you a couple of real-world examples that I dealt with relatively recently with a couple of my clients. I worked with someone just a couple of weeks ago where their employer actually paid a large portion of their premium for them. They had very minimum out-of-pocket costs, a very low deductible, and a very reasonable or low maximum out-of-pocket, and their medications were covered very well. In addition to that, the doctors they already see work very well within the network of their employer plan. So that person, it made no sense for them to opt into Medicare. Another client I worked with has a very low premium, but a high deductible to reach and a very high max out of pocket. So while Medicare actually cost him more on a monthly basis by way of premiums, it actually reduced his financial exposure and gave him more predictable costs in association with his healthcare. And that's my whole point. Two different people with two different sets of circumstances can mean two different things that make sense. When I do these comparisons with my clients, we not only look at premiums, so the monthly cost to have the coverage, but we also look at deductibles that have to be met, co-insurance that has to be paid prior to max out of pocket, and the maximum out of pocket itself. And we also explored the drug coverage and networks that they're already working within. Obviously, another thing to consider is if you're carrying a spouse or another dependent, sometimes you kind of have to keep your employer coverage in order to keep that person insured. Other times, say you're subject to IRMA. IRMA stands for Income Related Monthly Adjustment Amount. For certain higher income earners, it means a surcharge on top of the standard Part B premium, as well as the Part D premiums. And sometimes due to those surcharges, the cost to opt into Medicare prior to retirement makes no sense at all. Even if you choose to stay on your employer plan, you still need to make sure your coverage is creditable. For Part D, the creditable part is completely different than Part B. For Part D, creditability means that your coverage at work is just as good as Medicare would be in terms of covering your medications, or maybe even better. If your Part D coverage is not considered creditable and you don't take Part D when you're first eligible, you could face penalties down the road for the rest of your life. And when you retire or otherwise lose that creditable coverage through your employer, if you opt out of Medicare while you're working, you only have a short period of time to enroll into Part B and into Part D to avoid penalties at that time as well. You have 8 months to enroll into Part B when you lose creditable coverage to avoid penalties, but you only have 63 days to enroll into Part D to avoid penalties. So the biggest mistakes I see people make, number one, not verifying your employer size. Believe it or not, some people don't know how many people they work with. Number 2, assuming your coverage is creditable. If you're not sure, check with your HR department. Number 3, skipping a side-by-side comparison and assuming your employer coverage is better than Medicare. Number 4, waiting until the last minute. Your healthcare coverage is an extremely important decision. You want to make sure you give yourself plenty of time to explore all of your options so that you can make a fully informed decision. And that's exactly why I help people walk through this every single day. More and more people are working past their 65th birthday and not really sure if they should take Medicare now or wait. We offer completely free consultations, build a side-by-side comparison for our clients so that they can make a fully informed decision as to what's best for them. It's also why I created an entire workshop around working past 65 and your Medicare options, because there is just no one-size-fits-all here. Every single person has their own set of circumstances, own set of needs, and really your own preferences. I'm hosting a free virtual workshop on exactly this topic, working past 65 and Medicare. It's on May 28th at 6 p.m. Central Time, and I will walk you through how to evaluate your situation, including how to do a proper side-by-side comparison. If you are trying to decide whether or not to stay on your employer plan or move on to Medicare, this will give you the clarity you need. The registration link is below. And if you want to continue to receive more straightforward, transparent, and honest Medicare guidance, make sure to subscribe because I post new content every single week.